Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. I'm also a nurse educator. In today's video, I'll be going over 5 pharmacology NCLEX questions courtesy of nursing.com. Nursing.com offers NCLEX, study plans, videos to help you. If you're a visual and you don't like reading the textbook, then nursing.com is for you. They have videos that will walk you through med surg classes and all sorts of classes, practice questions, cheat sheets. Question number 1. If you are interested in joining nursing.com, check out my affiliate link below. Thank you. A nurse is preparing to administer an IV medication. Which of the following ensures that the correct dose is calculated? Select all that apply. Compare the dose with the drug reference book's safe ranges. Verify the dose and calculation with another nurse. Have the charge nurse administer the medication? No, that's not realistic. Contact the pharmacy to verify the dose. Rely on the IV pump software to determine the dose. Anything that's like rely on the IV pump. So the nurse should independently calculate doses, not just rely on technology, because technology can sometimes fail. So these are the correct choices. If this question was difficult, 21% answered this correctly. If you need to brush up on pharmacology, the good thing about nursing.com is that they link the video that corresponds to this question below. A client has an order for a blood transfusion. The client had a type and cross-match performed on admission and has type O positive blood. Which of the following blood types could the client receive in a transfusion? Select all that apply. Blood types O are the universal donors, but they are not the universal recipient. The universal recipient is type AB positive blood. They love all the blood. Maybe you can remember it that way. AB, they want all the blood. They're the universal recipient. And those with O positive blood can only receive O positive or O negative. Think of O for only. O for only. O can only get O. O, 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 only O. Here's a nice little chart for you. You can pause to read. A nurse administered digoxin lanoxin to a client with heart failure. Based on the nurse's knowledge of this drug, which intervention should the nurse perform before administering it? Check the client's heart rate, assess for pitting edema, monitor the client's oral intake, assess the client's lung sounds. Digoxin helps treat heart failure, and it increases the contractility of the heart. It helps the heart maintain a normal, steady, and strong heartbeat and reduces strain on the heart muscle. The nurse should not give the drug without first checking the client's pulse. So this answer made sense because first you want to ask yourself, what is digoxin for? And then whatever it affects, so for example, if I'm taking a blood pressure, if I'm giving a blood pressure medication, it would make sense that I'm going to check blood pressure, because if the blood pressure is already low when I give a medication that will further lower the blood pressure, this person is in danger. So the nurse should not give the drug without first checking the client's pulse. You can pause to read the rationales. A nurse chooses the dorsogluteal site on a client in which to administer an intramuscular injection. Which of the following should the nurse consider when giving an injection in this location? The dorsogluteal site is the safest because it does not contain major blood vessels. This one, this is the main issue, right? The sciatic nerve, and they really want, unless you're working in psych, it really is frowned upon to be giving IM injections in the dorsogluteal site. A nurse is preparing to administer 2 types of insulin to mix together for administration. The first vial has intermediate acting insulin and is cloudy. The second vial has short acting insulin and is clear. What administration principles are related to drawing up the insulin from the second vial? The easy way to remember is most of the time on the unit, at least where I worked, I did not have to mix insulin together. Did not have to do that. But an easy way to remember is clear to cloudy. Inject air into the first vial and then the second vial. Draw up the same amount of medication from both vials. Draw up medication from the second vial before the first. Yes, because we want to go clear to cloudy. So we need to inject air first, so that if you don't inject air first and you're trying to draw back that plunger, you won't be able to. It'll be very difficult because it'll be like a closed vacuum. Draw up medication from the first vial before the second vial. No. Inject from the first vial into the second vial. First, you draw up medication from the second vial clear, followed by the first vial cloudy. The medications are mixed with the syringe, but they cannot be injected back into either vial after they have been combined within the syringe. The nurse should inject the air. You can pause to read the rationales. But once they're in the syringe, then they're ready to be administered. And based on the diabetic person's response to insulin, there's going to be a specific amount of each type of insulin. It's not just arbitrarily the same amount all the time. Thank you so much for watching. Make sure you smash that subscribe button. I'm trying to reach 30,000 subscribers by the end of September. It helps other students find my channel. And the challenge for today is go out and do one random act of kindness. Until next time.